lady doctors. The thing is that first I think that there are gender issues. In that these were women, they were men, and women were generally considered to be of lower status, that they needed male protection, but they should take orders from doctors or husbands or fathers, because as you're probably well aware, for Hindu women, according to the laws of Manu, they're supposed to be dependent first on their fathers, then on their husbands, and then on their sons. However, I think it's also could be professional rivalry. Indian male physicians wanted to distance themselves from Indian female doctors who had lower status than they did. And frequently, women doctors had these lower statuses and less education because A, they frequently lacked science education, B, they had a lack of parental support and financial resources, because I talked to one woman whose mother had been a doctor, or had wanted to be a doctor in the 19-teens, and her father said, your mother's died, you're the oldest of 9 children, go be a teacher. You can start earning money right away. Don't be a doctor. This woman, they were Christian, Tamil Christian. She then married someone who was active in the YWCA and said, okay, I'll take care of you. You can go to the Madras Medical School. And what I think was really interesting, he let his wife and first child go to London to have medical training at the college, or the hospital for sick children. I always love these English things. Don't just sick children go to the hospital, but anyway, it's the hospital for sick children. So that there was a lack of parental support, and there was also discrimination at the medical schools, which is a whole other thing I could go into, but I won't. And I should say, the Madras Medical School was the first medical school in the British Empire to admit women in 1876. It admitted 4 women before women could go to medical school any place in the British Isles. Now, another thing which was a reason why men might discriminate is that some might have financial motives. In the 1880s, there was a Dr. Hemabati Sen in Bengal who was trying to establish her private practice, and she mentioned that all doctors had their own midwives and monopolized the practice. Also, there were, they quoted people from Britain, which said that the most opposition to child welfare clinics in Britain came from doctors who practiced in that area. So this brief overview reveals that we can learn much about working conditions of subaltern Indian medical women as they struggled to implement a key nation-building institution. These women confronted low pay, collapsing houses, wet rickshaw rides, sexual harassment when they traveled at night, and sickness that might have been contracted by working in insanitary surroundings. They struggled for professional recognition based more on their work experience than on their medical education. And so I think I'm going to stop here because I want to give you time for questions. I'm sorry I went a little bit over. Let's see if there's any more slides. But oh, here's the fortnightly weighing of baby's weight was a sign of health. And then here's Viscount Goshen. She was the wife of the governor, and both she and the governor had been supportive of child welfare and infant health in Great Britain. And so you can see that it was a scheme that expanded, and the other thing I should say is that Tamil Nadu has much better health rates of both infants and much higher infant and maternal mortality, I should say lower infant maternal and infant mortality rates than many places in the north. And I think part of it is that they did start this. And India, in Madras, to this day, they still have healthy baby contests, which are the baby weeks. And I asked them, what did they give? Now they give utensils, and what are the criteria? And they still have the criteria of breastfed babies, but now it goes down to family planning and inoculations and various things like that. So, any questions? And there is someone, I heard that you're talking about HIV in here, who's working on Madras and infant and maternal health and of women who are infected with HIV, but I don't know anything